Hi, I'm Mackenzie McFadden, and I'm going to show you how to control bleeding from a cut on a forearm. This is Morgan. She's going to be my victim. So if this were a real life scenario, I would just introduce myself first and get permission to treat her. So, hi, my name is Mackenzie. I'm first aid certified. Is there anything I can help you with today?
My arm.
You cut on your arm?
Yes.
Okay. So before I inspect the cut, I want my hands to be clean. Usually I use warm soap and water, but for the video, I'm just gonna use hand sanitizer. So I'm gonna wash my hands first, let this dry, and then I'm gonna put on some gloves. This is not only to protect me from any blood-borne pathogen disease that she may have, but also to protect her from infection. Even though I use the Germ-X, I don't want to get anything in that cut that could potentially make it worse. So once I have these on, I'm going to examine the cut. If I see that it's just a straight cut, no arteries are nicked, the bleeding's not too bad where we would need to call an ambulance or take her to the ER, then I would feel comfortable treating her like this. So if I see that cut, I'm gonna go ahead and wash the wound before dressing it. I would usually use, again, warm soap and water, but just for the purposes of the video, I'm just gonna use some Germ-X here, okay? So you wash the cut, and then you wanna apply a sterile dressing, like some gauze here. Once you place the gauze on the cut, you're gonna wanna hold some light pressure down for a couple minutes just until it stops bleeding. If the bleeding is significant enough to where this gets all bloody and you're gonna need another gauze, don't take this one off, because peeling it up could run the risk of peeling up the scab and the clots that are already forming underneath. So I'm just gonna hold this for a few minutes. Once the bleeding stops, I'm gonna take a roll bandage and I'm gonna wrap this around the gauze. So I'm gonna come here and go 2 times around straight, and then I'm gonna start a crisscross pattern, essentially until I run out of gauze or just have enough left to do 2 straight lines again. And then once I get to the end here, I'm just gonna tuck it in so that it stays secure. Okay, and you don't wanna make this too tight to where they're losing circulation. So is it too tight? Can you move your hand, move your arm around? Feels okay? You just wanna hold it there to keep that pressure, make sure it's not bleeding out anymore, okay? So once they're done, you want to safely dispose of your gloves, which probably have blood on them. So you're going to pinch the end here, take it off, ball it up in the hand that still has a glove on it. Then you're going to put 2 fingers underneath the inside of the other glove and roll it so that all the contamination is in one spot. And then you dispose of these in a sealed bag or in a biohazard specific bin. And that's it. That's all you gotta do.